Hello, everyone. It's Dr. Nirapundia. A lot of people have questions about what exactly takes place during ACL surgery. Here's a quick breakdown of some of the basics. Now, when an individual tears their anterior cruciate ligament, or which is otherwise known as the ACL, the knee can be unstable. So you're an active athlete or engaged in a lot of physical activity, this may be something that needs surgery. This is something you should talk to your physician about if you have an ACL tear on your MRI. In addition, when you tear your ACL, you also can potentially have meniscus and cartilage injury as well too. So in order to help your pain and restore your function, whatever your goals may be, you may need to undergo surgery. Now, the important thing to understand is that for the vast majority of ACL surgeries, you're not repairing the ligament. Once it's torn, you're not sewing it back together or reattaching it to bone. The vast majority of ACL surgeries are actually an ACL reconstruction where you're putting a new ligament inside the knee. Now, there are various different options in terms of what tissue you can use to make a new ACL. It's based a lot on terms of your anatomy, what your function is, and what your age is, and what your sporting goals are as well too. For some patients, particularly who are older, you can use cadaver tendon from someone who's passed away. For younger patients who may be stressing their knee more, you may use your own tissue around the knee. That could be your quadriceps tendon, it could be patellar tendon, or it could be hamstring tendon. Which graft you use is based on your activity level, surgeon preference, and what they're comfortable with, as well as some of your own anatomy as well too. Now, what is typically done during surgery, you first start by putting a camera inside the knee. And what you're doing is taking that camera, which is also known as an arthroscope, and repairing any damage to the meniscus and cartilage. In addition, then what you do is take out some of the damaged ACL tissue, because once that tissue is in there and that ligament is damaged, you want to get that out of the way so that you can put the new ligament in. Then what's basically done is then you're taking basically that quadriceps tendon, that patellar tendon, or that hamstring tendon, and basically creating a channel in the bone where the ACL used to insert and placing that tissue inside small little channels in the bone. They're usually held in place with using a combination of screws or basically suspensory devices. And then what happens over the recovery process is that tissue basically then heals into the bone and becomes a new ligament. Now, in general, rehab protocols will differ, but in general, it takes somewhere between 9 to 12 months for that ligament to fully heal in from that new tissue that you put in, as well as regain the strength so that you don't basically then re-injure that knee.